2020 is a year that a lot of us will never forget. This is the year that the COVID-19 pandemic hit everyone worldwide, and it caused people to lose their jobs, to, pass away. It destroyed people's mental health, from, not being able to go out and socialize. And this is something that we can all relate in. This is something that we're all dealing with and trying to get past every day and trying to cope with. I'm a pre-med student, and this past summer I had the opportunity to go shadow my aunt in Far, Texas at a clinic during the pandemic. Being here, it was very eye-opening. It was very sad. It was stressful. It was heartbreaking to see that so many people were trying to get tested and, tests ran out. It was just very chaotic and very stressful and eye-opening. So I want to persuade the public to, if they haven't already, to start, and if they have, to continue to follow the guidelines that are being set in place during this time, because these guidelines are being put in place to protect us. They're being put in place for a reason. So it's imperative to follow these safety guidelines of wearing a mask, social distancing, and trying to be as clean as possible. So with wearing a mask, you want to make sure that you have the right type of mask, because there are many different types of masks that are being made with different types of fabric. So a study came out and showed that the N95 is the best mask to use. It was the most effective. The next was the surgical mask, it was the next effective. Another one was the homemade mask. As long as they were being made with tightly woven fabric, they were said to be effective. Things that didn't come out to be as effective are things like the bandanas or mesh masks that people wear with the holes. The whole purpose of a mask is to not really protect yourself from getting anything from other people, but it's to protect others, so to stop whatever you have, your germs, from getting out into the environment. So if we're not all on the same page and not all wearing masks, then it defeats the purpose, because there's still germs being spread. So with getting the right type of mask, you want to make sure you're wearing it properly. That means it covers your nose, your mouth, and your chin. If it's not covering your nose, it's not covering your mouth, the virus spreads in the air. You can inhale it and get it in your respiratory tract. So you need to make sure that it's covering your nose, your eyes, your mouth, and your chin. The next thing is that it can't be loosely fit. It has to be fit snug around your face. So if it's not snug around your face and there's holes or gaps, the virus can actually sneak in through the cracks, and that's not what we want. Some may ask, what if they don't have COVID? Do they still need to wear a mask? And the answer is yes. Some people, the virus affects them differently. So some people are asymptomatic, meaning they don't show symptoms. So if they don't show symptoms and they don't know they have COVID, then they're just spreading their germs. So we need to make sure that we're all wearing a mask. So with wearing a mask, how it can be effective alone, having other guidelines set in place can help decrease the spread of COVID. So social distancing is my next guideline that we should all be following. This means no parties, no concerts, no weddings, things like that, if possible, should be postponed. It's not worth it in the end. Like, the temporary fun is not worth the consequences in the end, and I can speak from personal experience that I lost a family member due to COVID-19 because they were around family members. It's just not worth it in the end. Don't want that. So make sure that you're social distancing and not really doing all those things. So another is limiting your outings, such as going to grocery stores. Try to plan ahead of time and try to get that all figured out so that you can go get it and leave. You don't want to keep going back and forth, because that can increase the chances of spreading COVID or you even getting COVID. And things like barbershops and nail salons, these are things that aren't as necessary. So if you don't have to go, don't do it. Don't go. And if you do go somewhere, try to be somewhere that's outside. Don't be somewhere inside, because to William Schaffner, a professor of infectious disease at a university, if you're inside, there's less ventilation, and this can increase people's chances of getting the actual virus. And you also want to stay 6 feet away from people and try to limit the amount of people that you're around. So, as these two guidelines are effective, my last main point is to try to be as clean as possible. That means washing your hands. Have good hygiene. After everything, wash your hands, and that's with soap and water. 20 seconds under the sink, back and forth, wash your hands. You can use Germix wipes and like other things, but the most effective thing is to wash your hands with soap and water. And next is to clean highly touched surfaces, such as like doorknobs, light switches, things like that, your phone, things that you're always touching constantly. The CDC recommends cleaning these things at least once daily. So if we follow these 3 guidelines that they have set in place for us, we actually have a chance at lowering the spread of COVID. And with the lowering of the spread of COVID, that means less people will get COVID, and that means less death. And this is the ultimate goal that we want to get to. There has been studies that show that these methods are effective. They're not just something being put in place to tell you what to do. They actually work, and a group of chemists by Texas A&M actually did a study of the numbers of cases before masks were put in place or like made mandatory, and after they were made mandatory, and the number of cases reduced by 66,000 in New York in 1 month, and 78,000 in Italy. It reduced by 78,000 in Italy in 1 month. And this is with just the mask guideline put in place. So if everyone is following the other 2 guidelines along with it, we really have a chance at lowering the spread of COVID. And with that, there won't be any more lockdowns now. The more freedom they give us, it's more crucial that we follow these guidelines. It's our best chance to decrease the spread of COVID and maybe hopefully eventually get back to where we were at to begin with. Thank you.